Why is there an overall tendency for doctors to not actually listen to their patients? I have this close relative that was at an important appointment recently discussing what to do about the hernia that has been growing near her heart and stomach. And this complication now, a side effect, is developed shortly after an open heart surgery last year. So this relative got some very weird but very unsurprising reactions from the doctor. And these reactions, they went something along the lines of, I'm not interested in the heart. If you have questions about that and the heart, you have to go to a cardiologist. I'm only focused on the hernia, only the hernia. This is what answer she got when she asked how the hernia developed and what to do about it. What was the connection between all of it in her body? And when they started talking a bit further and she did get her questions answered, she wanted to describe her own experience of the pain and the difficulties that she's experiencing right now in her body. And the doctor said that he essentially said that he's not interested in my relative's findings, because if it's not in the journal of the former doctor who referred her to this new doctor and it wasn't written down, then he doesn't take any of her words into consideration. And you have to bear in mind that this relative is a nurse of over 30 years experience in the medical field. So she knows what she's talking about. So the doctor didn't want to listen to the patient's own experience and finding of what goes on in their body. And they only wanted to listen and look at lab results. And I just find it so strange. They're not interested in seeing a holistic picture to the problem, because they're specialized in only one thing. Done. Just like that. So what has gone wrong in the medical field? Where is the do no harm oath? And I know that some of you will have a fortunate experience, thank goodness for that. But the vast majority of us will be failing or falling through the cracks. We'll be pushed from one doctor to the next. A little bit like compartmentalized lab rats or something. And I speak from personal experience of many, many, many visits to doctors over the years, because I had a sick heart when I was younger as well. So I really know what I'm talking about, and I know a lot of people who have been in the system. And it just makes me wonder. I mean, in the country that I live in, we pay one of the highest taxes in the world. That is supposed to ensure us when we go and are sick and go to the medical system. It's supposed to be really, really good, because we pay almost half of everything we earn to the system. And so I ask myself the question, where does the money go? Because it doesn't seem to improve the standard of the care that we get. It actually is slipping and becoming worse. So if I want to have a chance to be taken seriously, then I have to go private and pay out of my own pocket, even after I've paid half of my salary to the state. I mean, it doesn't make any sense. It doesn't add up. So many of us get subpar treatment in the general medical field. And when I zoom out and look at it, it's no wonder. Generally, doctors are not taught to treat root causes. They're taught to treat symptoms. So if you go to a doctor with a problem that isn't life-threatening, then there is a high probability that they will suggest medication. So you take that medication, and maybe it helps you a bit, but after a while you develop a side effect to that medication. So you go back to tell your doctor about this, and then he or she suggests an additional drug that will take the side effect of the first drug. And then the wheel goes on, with you ending maybe with 10 cases of different drugs, one helping the other mitigate symptoms and side effects. I mean, it doesn't make any sense.